And the first thing I want to talk about is really just the role of insurance companies and the insurance coverage and the gaps and things that like people have to worry about because, there is some things with insurance companies that technically kind of make the situation worse for people. And I'm going to talk about a few things here. Many insurance plans do not provide adequate coverage for mental health services, forcing individuals to pay out of pocket or forego treatment altogether. Insurers may impose strict criteria to determine what constitutes as a medical necessity, limiting the number of therapy sessions or types of treatment covered. They used to do this a lot. Back in the day, I know that if you only had Medicaid, I think you could only go to therapy like 3 times. I think they've changed that since then. But even physical therapy, they were doing, you could only go a certain amount of times, which I thought was weird. It's like, I thought you just went until, you were better with especially with physical therapy. Despite the Mental Health Parity and Addiction Equity Act, insufficient enforcement at the state and federal levels contributes to continued gaps in coverage and access. And then there's affordability challenges with the high out of pocket costs. Individuals may face out of pocket costs due to inadequate insurance coverage, contributing to significant financial burdens and forcing them to delay or abandon care. Lower reimbursement rates for mental health services compared to physical health services create a disincentive for providers to join insurance networks. This one is crazy to me because what they're saying is that insurance companies give lower reimbursement rates to the facilities or whoever's doing it with mental health services than they do with physical health services. So then that means that makes it obviously, just as they said, a disincentive for providers to join insurance networks because the insurance is making sure that they're not going to get as much money. And that's tough. And then the other thing is I just want to talk about the two-tiered system, the combination of limited network options and the high cost for those not using insurance can create a two-tiered system where those who can pay out of pocket have easier access to care than those who rely on insurance. So, what should the insurance companies be better about this, Brandon?
I don't know. The whole insurance situation is such a mess.
Yeah,
I don't even know what to do about that. I think that it's really screwed up how insurance companies are the ones informing what the doctors can do.
right.
That whole paradigm is upside down. I don't like it, but I don't know what to do about it. This is not a very great answer. I don't think this is going to perk anybody's ears up, but that whole system just needs to be overhauled. I'm sure there's better systems out there. Yeah, I don't know. This is one of the dark sides of where we've gotten to with in the US with how we handle these sorts of things. Mental health, really, honestly, yeah, medical insurance as a whole
Yeah.
is
Maybe a whole
is in a
episode
really
by itself. I don't know, but
absolutely, yeah. And I don't know. I actually want to hear your opinion on it, and maybe I can riff off of that because I'm not really sure what I'm thinking about it. Besides the fact that it's really screwed up, it's not working great. It's not working for most people. It sort of feels like the housing market right now, where it's like I don't under like, is it gonna collapse? It just feels like it's not gonna. Not only does it feel like it's not working for anybody, but it feels like it's not gonna. It's like we're all talking about it as if it's not working. But then why is it still there? Like, why is it still going the way that it's going? And I try to be a positive person, but that feels like one of those things where it's just going to get worse and worse for like the next 20 years before we actually get to a real breaking point. And unfortunately, over the next 20 years, it just looks like more suffering and more high costly insurance coverages that don't actually cover the things you want them to cover, and people just being left more and more in the dark. Yeah, and that's one of the absolutely broken things about, like, there's lots of great I'm